7 o'clock, folks, on the family station Love 101. It's time for the morning watch brought to you today by your friends at General Accident and Home and Things.
There is an easy way for insurance coverage today. With no line in your way, all you have to say is
Genac.com. Everything you have is everything you have. So keep your assets covered and save 10% off your insurance when you renew by visiting Genac.com. You don't need to go into a branch. You can do just about everything online at Genac.com. Remember, smart insurance saves. Who knows what tomorrow brings? So future-proof everything.
insurance on the go. Trust the brand that you know.
Genac.com.
All you have to say is Genac.com.
General Accident Insurance Company. Future-proofing tomorrow.
Imagine styles of tiles for every room. So trendy, sophisticated, stunning, yet cool. Simply unique. Tiles for floors to walls and everything in between. Make your best home anything but ordinary. At Home and Things.
Listeners to Love 101 FM are advised that the views and opinions expressed in this program are not necessarily those of Love 101 FM.
Hello and welcome to the Morning Watch on Love 101 FM. I'm your host, Dylan Toussaint. A special welcome to our listeners on love101.org. And if you're overseas and on the move, US listeners can access us at 712-832-8001. And if you're in the UK, 0330-332-6541. Or join us via the Love 101 FM app that can be downloaded from the Google Play Store or Apple Store. You can also join us on Love 101 FM Facebook and YouTube Live. In the first watch today, pharmacists and the administering of vaccines. In the second watch, the prisons, COVID-19, and vaccine hesitancy. Our social media question we ask: what are your thoughts on pharmacists administering the COVID vaccine? Please share your responses on our Facebook page, Love 101 FM, and also on WhatsApp, 876-997-3125, using the hashtag The Morning Watch. We'll share your responses later on in the program, but before all of that, here's I quote.
This morning's I quote: anyone who thinks they are too small to make a difference has never been in bed with a mosquito.
Good morning. Good morning, Shivani.
Good morning, Graham. How are you?
I'm well. Have you ever been with a mosquito?
I think so.
Have you ever been with a mosquito?
Well, they're all around. I can't control it.
Boy, I tell you, I want to make a confession right here and now, Shivani. I hate mosquitoes. Don't
we all? Don't we all?
I certainly hope so. You know, somebody told me once that asked me what is the mosquito's favorite hymn. Do you know? Do you know, Shivani?
They're humming. No. What's their
power
favorite?
There's power in the blood. There's power in the blood. Power in the blood.
Oh, there's power in the blood. I said, Dr. Christy.
Leave it alone, Shivani. Leave it alone, Shivani. Leave it alone. Leave it alone. Leave it alone. The first watch will be back after this break.
The first sound they make is to simply let the world know they're here. And then it's our duty to help them show the world why they're here in the first place.
Give them every advantage with the Guardian Achiever, a plan that provides for their educational dreams and protects their health and life in the process. For more information, call 888-4LIFE to speak to an advisor or visit myguardiangroup.com.
Hello? Morning, Mary. Is where you there for morning me calling and can't hear from you? Child, me dey go on out of the supermarket. Supermarket? Somebody a foreign send something for you? No, me get the social pension payment. You mean the government program that you did tell me about? Same one. Oh, You get yours? Where me did I go? You mean you sit down and never go look about little benefit? And you could, huh?
Senior citizens, have you applied for your social pension benefit yet? What are you waiting for? Visit the Ministry of Labour and Social Security's office in your parish. Take your birth certificate, a government ID card, TRN card, and your bank account details. If you don't have a bank account, we will pay your benefit through a remittance agency. The next payment will be in September, so don't delay. Apply now. For more information, call 876-922-8007 or visit the Ministry's website, mlss.gov.jm. The Social Pension Program, caring for our elderly. A message from the Ministry of Labour and Social Security.
Yes, miss, the online class is going well. My parents got big tablet savings from Flow, so I learn smarter and better from home.
Smartness runs in your family. Get 2 Samsung LTE tablets for only $6,000 plus GCT each when you bundle up your Flow mobile and home internet. Keep everyone connected to success with fiber fast internet and a new tablet for every lesson and study session anywhere. Visit a Flow store or discoverflow.co for excellent tablet savings. Conditions apply.
There are a million reasons to want to own a home.
I want more space for the children.
I am tired of paying rent.
My wife and I want an investment. Go from future plans to keys in hand with an NCB mortgage. Get rates as low as 6.95%, 100% financing, and up to 40 years to repay. Plus, get the life insurance and home insurance you need all in one place. Visit myhome.jncb.com to get started. Conditions apply.
Welcome back to the March. I'm your host, Dylan Toussaint. Well, with what looks like an uptick in the number of persons wanting to be vaccinated and the ever-increasing positive cases of COVID-19, the idea of pharmacists assisting in administering the vaccine has again been raised. But how possible or practical is that idea? And what are some of the challenges and or difficulties associated with doing so? Well, to discuss these and other related questions, we have online Dr. Maurice Guy, Opposition Spokesman on Health, and Dr. Winsome Christie, Clinical Pharmacist and President of the Pharmaceutical Society of Jamaica. Good morning to you both.
Good morning, Dr. Christie. Good morning, Dr. Toussaint.
Good morning,
Okay.
Guy and Mr. Toussaint.
Morning.
Thank
Good. That's good.
you. Harry.
Right. Good to have you both with us this morning. All right. Let me begin with you, Dr. Christie. What is the current policy in regards to vaccinations being done by pharmacists in Jamaica?
Well, currently, the legislation does not recognize us as providers of immunization. In order for that to happen, the certain legislation like the Public Health Act and the Pharmacy Act and regulations would have to be updated to, first of all, include us in the definition of a public immunization officer, and then the Pharmacy Act and regulations would also have to increase our scope of practice so that we can be recognized as persons who provide immunization, and also for us to be able to administer emergency medicine during an anaphylactic reaction, if that does occur, where we'd have to administer epinephrine or diphenhydramine, depending on the severity of the.
And why is that not so now? Why is it that that policy has been around for all this time and you have not been given the authorization to do that?
Well, I am not a legislative person, so I wouldn't be able to change the legislation. The Pharmacy Council of Jamaica has revised the laws, because in every country you have to revise laws from time to time, depending on the situation, to allow things to happen. For example, in the UK, they had to revise the laws to permit virtual AGMs, annual general meetings, to be held. And they did that last year so that it could happen, and because of the pandemic. So for us, we would have to revise these laws to facilitate pharmacists administering vaccines.
Okay. Dr. Guy?
Yes, sir.
Dr. Guy, you with us? Right, right.
Yes, I am.
What's behind all of this? Yeah, what are your thoughts and concerns in that regard?
Well, first of all, as Dr. Christie said, there are changing circumstances, and one would have to adjust the legislation based on the demands of the circumstances. We're in a pandemic right now. I gather, though, that prior to this pandemic, there were efforts made by the Pharmacy Council for the government to look at the legislation as it applies to their administering of these vaccines, or any vaccines for that matter, in line with what happens in other jurisdictions. In the USA, it is done. There are two aspects. Well, the legislative part of it is something that the government, the Ministry of Health, ought to look at. I am in support of it. First of all, let me put it on the table. I'm in support of it. Secondly, the reason for my support is that I think pharmacists have gone through extensive training and they have the necessary expertise to be able to do it. And to have the legislation of justice to give them coverage under law would be a simple matter for both the lower house and the upper house. The other part of it, though, is that there are two aspects to it. And one is it whether you allow pharmacists or whether you allow pharmacists and pharmacies. Because you recognize that there are some pharmacies which may not have the infrastructure to support such a program. And there are some pharmacies which do. But I think the starting point is to allow the pharmacists with the ability legally to do that. And further, I'm also of the view that in a pandemic, one needs to sometimes think outside the box. You can't say, okay, that this piece of legislation is needed and you're going to take the usual time, as it does in many pieces of legislation in this country, to get enacted. If you want to look at even the Road Traffic Act, we're looking at it about 10 years now. So it would be a simple amendment. It would be one that could be done in the lower house in one sitting, and certainly in the upper house in the other sitting, and the accent of the Governor General to make it law.
You mentioned about pharmacies vis-a-vis pharmacists. Could you say more on that? I'm not clear in my mind, at least.
All right.
What's the difference?
For example, I think, okay, the current situation is that the Ministry of Health has only a set amount of health workers to administer the vaccines. They've been calling for retired nurses, they've been calling for retired doctors to come and help in the process. I think if the legislation is changed, then pharmacists could also be roped or called in to do this particular part of the work. That's one. And that's why I said pharmacists as opposed to pharmacists. Secondly, as obtains in the States, in the United States, you have people going to pharmacies, these large pharmacies where there may be facilities such as sitting areas where you can do observation, where you can also do the anaphylactic treatment if there does occur. And I say that against the background that many of our pharmacists in Jamaica are small outfits which do not necessarily have that, which hence my making the distinction.
Yes. Dr. Christie, I'm sure you want to respond. You're muted. Could you just unmute so we can hear you?
Thank you. Thank you, Dr. Guy, for your comments. They're very simple and clear. Some pharmacists who do not have those type of facilities, it would point now to the fact that the Pharmacy Council would grant licenses to only those pharmacists and pharmacies that meet the criteria, that have undergone this extra training, which we have. We have two models at the moment, a fully online one that comes from the California Pharmacists Association, but you still end up with the American Pharmacists Association certificate. And we have one that's been offered by our local PSJ, local trainers.
I'm sorry.
Those are
I'm sorry, Dr. Christie. Could you just hold that thought, please? We're at a break. We'll be right back.
First in a class when you have Digicel. School as Prime Bundle. That's right, with your educational website make you bright. Head to the top of your class with your first Digicel SIM and a School as Prime Bundle. Get over 142 gigabytes of data so you can have access to educational sites, social media platforms, Digicel apps, and more for as low as $1,500 for 28 days. Get a School as Prime Bundle with your first Digicel SIM card. Visit a Digicel store today. DIGICEL.
Let's build strong bonds. Take advantage of the NCB Financial Group Limited bond offer with a minimum investment of 100,000 Jamaican dollars attracting 6% interest per annum paid semi-annually. Don't let this wealth opportunity pass you by. Offer opens August 13 and closes September 9. Text the bond to 876-383-2076 or email multi-channel NCB Capital Markets at jncb.com to get started. Start building generational wealth today. Conditions apply.
Welcome back to the Morning Watch. Thanks for staying with us. I'm your host, Dylan Toussaint. And in this, the first watch, we are discussing the whole matter of pharmacists and the administering of vaccines. And in so doing, we have Dr. Maurice Guy, opposition spokesman on health, and Dr. Winsome Christie, president of the Pharmaceutical Society of Jamaica. Dr. Christie, before the break, you were responding to a comment that was made by Dr. Guy earlier. Please continue.
Yes, Dr. Guy was making the reference to the point that not all pharmacies...
Yes, Dr. Christie, please continue.
All right. Dr. Guy was making reference to the point that not all pharmacies will meet the criteria because of their setup to administer vaccines. And that's where the Pharmacy Council would come into play. Now, they would offer licenses only to those pharmacists who have done the requisite training and those pharmacies who have the infrastructure to administer the vaccines, just to support what Dr. Guy was saying. Thank you.
Okay. All right. Well, still with you, Dr. Christie. Oh, I'm sorry. Dr. Guy?
No, I was also paralleling that with the call by the medical practitioners to be involved in the vaccination process. For those medical practitioners who usually administer vaccine and have the facility not only for storage, but the space for also observation in their offices as well, because not all doctors do vaccination programs. And you might have heard that I have been one of those strident callers for the government to expand the program to involve the private practitioners who have the space, who have the experience, similarly and akin to what I'm calling on the pharmacies, and Dr. Christie explained just now.
Yeah, interesting stuff. Dr. Christie, we're talking about training, or there's talk about training. Approximately how many pharmacists are trained to administer vaccines? And by the way, what's so technical about this process? What's so technical about it? It's a job in somebody with a needle.
Okay. Well, it is very technical because it involves people's lives. Because if someone's having an anaphylactic shock, which is a very severe allergic reaction, the body can shut down and they can die. The lungs constrict, breathing, etc. So the training we have is a 20-hour course that involves theory, 5 modules of extensive theory. In fact, I have my books here to prove it. There we go. All of these are the 20-hour courses that we have to be doing. Then we do a pre-test. Then we do a pre-test. Then we have an 8-hour practical course where we do the injection techniques. After we've undergone, and it's 5 different ways in which medicines can be administered. So we have the intramuscular, subcutaneous, and then we do the nasal and other routes of administration. But basically, the vaccines are either intramuscular or subcutaneous. But the COVID vaccines are mostly intramuscular. So we have to go through those techniques of injection where we actually physically.
So the sub what you mentioned, what is that? The second word.
Subcutaneous means under the skin. So like the insulin injection that person can do for themselves are subcutaneous injections.
Yeah.
So it's just basically.
Okay.
When you're doing an injection, you have to angle the needle at a certain angle. Okay. And after you do this intensive training, you then have to do a cardiopulmonary resuscitation training, which presently the St. John Ambulance does, and the Heart Foundation does that too. So we have to do that. I believe that was a 2-day course, 2 or 3-day course that we did. And you do both of those for the administrator, because it is, I mean, we make it look easy, but it is a technical thing. Once it involves lives, you know, it is technical, and you have to be trained to ensure that you do no harm, and you do the best for the clients.
And approximately how many pharmacists are trained so far to do it?
Well, so far 56, and I think why the number is so low is because, you know, in Jamaica, just be honest, our economy is rough. So persons don't really have that amount of disposable income to just get up and say, oh, let me go and spend this extra money to train. Do you understand?
Oh.
So yes, it's available, but persons, if they knew they would be able to use it, it takes a special kind of person to do extra training. And Dr. Guy can agree to that. As a medical doctor or any professional.
Any profession.
Any profession. You do your training, but to do extra, it's really a special kind of limited group that does that. And people invest tons of money into their education, even if they're not going to use it because they love it and because they want to improve their profession. And that's how professions move forward. So unfortunately, 56 is trained now, but we do plan to roll out more training. And if the incentive is that they know they're going to be able to use it, then I'm certain more will do it, you know?
Yes.
Yeah, but at the moment it's 56.
Yeah.
I think if 56 are thrown in, and it's not just about 56, it's the reach that pharmacists have. The studies show that once pharmacists are involved in vaccination programs internationally, the uptake is much more, especially in the community settings. Because people trust the pharmacist. Right now, people are telling me, if you're going to do the injection, I'm going to take it, you know, and they ask me, you know, not do it yet, you know? So people trust them, you know?
Yes.
Well, not that they don't trust the doctor. It's just, you know?
Which Dr. Guy wanted to come in, but I wanted to come in as well with this, responding to this question. You mentioned earlier, Dr. Guy, that it's a simple matter for both lower and upper houses. Why has it taken this long?
Well, I really cannot answer that question because I'm not at the forefront of the thrust to do it. Now that the pandemic is on, the question has been raised again, and hence my comments that for it to happen, then it is a simple process. It doesn't take much. As long as the drafting is done by the ministry, it is approved by the Chief Parliamentary Council.
But Doc, you've been a parliamentarian for a good while.
Yes, but a parliamentarian not in the Ministry of Health. It has to come through the Ministry of Health. It has to come through the fact that there is advocacy on the part of the pharmacists to do that. I am saying now that the issue has come up recently as a result of the pandemic and the fact that there are more hands required on them. It came up during the crisis we're having now, which coincided with the break in the parliamentary session. So even say a call for it in the pharmacy, in the parliament, would not necessarily fall on any ear right now until we resume the sitting of the parliament. The onus would be on the Ministry of Health to say, okay, we need more hands on deck and we are rushing this piece of legislation. The government would have to call back the parliament to the session before the break ends, which is part of our understanding when you're going to break. So it is not say the parliament is going on now and then this has come up and then we say, okay, even from opposition point or a member of the parliament to say, Minister, what is happening here?
Yeah, I'm still a little puzzled, I must confess, because I remember when I asked Dr. Christie earlier, she mentioned that it's a legislative process, right? And you as a parliamentarian are part of that legislative process. Now I'm hearing you talk about the Ministry of Health, but isn't it back to the legislators of the land to do that?
No, the process of enacting or changing legislation goes through a particular route where it goes from the parent ministry. Then it goes to the Attorney General's department to see whether it conforms with the other legislation in the country. The Chief Parliamentary Council has to draft that. The AG looks at it. Then it goes to there's a committee of parliament known as the Legislation Committee of Parliament. Sorry, of Cabinet. Cabinet, my apologies. And then after that, now the bill comes to the Parliament. All I'm saying is that this process with the bill coming to the Parliament would not take long. So it is for those in terms of how the sequence is done. The only other way that a piece of legislation can be done is if a private member's motion in the Parliament, you have a debate on it, then it goes through the same process I alluded to a while ago.
Dr. Christie, as we wind down, there are concerns, and I'm just trying to drill down into some possible reasons for this thing lagging out so long. But there are concerns, I gather, that the inclusion of pharmacists in the vaccination exercise may serve as a distraction from their core duties. Also, there are those who are arguing that it may reduce the supplementary income that some nurses already are having from enacting the vaccinations. What are your thoughts on that?
Well, for those who say it would detract from our core function, that isn't necessarily so, because that's why we have pharmacy technicians to help us in our daily activities. And pharmacists are not just dispensers, they are managers. They manage their time and they manage their resources, and they can get through whatever they need to be doing. It's just a matter of organization, using your organizational skills. Okay. But for the nurses, I can't.
Yeah, the income concerns. I mean,
well, there's enough persons in Jamaica for vaccination. We have a population of over 2 million. I'm certain the dent that pharmacists will put in the projected income is just fear driven, and it won't really impact, because really right now persons are complaining that they're not even getting their pay, or they're overworked and they need help. That's the cry that's coming out. So I'm not really sure what will happen.
Yeah,
I think it's more
okay, great. Fair. Okay, Dr. Guy, you have the final word. What's your take on that?
Well, Reb, I'm surprised that you paid devil's advocate, in asking.
Never will. No. It's just out there.
But just to say, we understand. Just to say, first of all, I don't think the latter concern about eating into the nurses' income is really a matter for concern, simply because they are overworked. And as Dr. Christie said, we have 2.8 million people in Jamaica who need vaccination. And at the rate we are going, we're not going to be able to use all the resources that we have at the public sector and at the public sector to do it. And one other point I want to comment on. She mentioned about pharmacies, patients, clients being comfortable with their pharmacists. I prescribe in my medical practice, and there are some clients who say they're not going to the pharmacy until that particular pharmacist is there to fill the prescription. That's the faith and confidence they have with them.
Yes. And therefore, going forward, we are all hopefully on the same boat, same page. I'm hoping, though, Dr. Guy, that along with all these discussions we have been having, that in short order, we have the pharmacists on board. Because
we're expecting the Ministry of Health to do something with alacrity.
Ministry of Health.
Yes.
Again.
No, they are the ministry which will start.
Oh boy. Okay. Want to thank you both for joining us. Dr. Winsome Christie and Dr. Maurice Guy. Have a productive day. Bless you.
Thank you.
very
Pleasure
much.
being with both of you, Dr. Guy and Dr. Toussaint. Thank you. Bye-bye.
Bless you. Bless you. All right. Listeners, the Morning Watch will return in just a moment.
Your NIS pensioners, avoid the wait. Get your NIS pension straight to your bank account. It's easy. Simply visit the Ministry of Labor and Social Security's website, mlss.gov.jm, or the nearest NIS office and collect the direct deposit application form. Then complete the form and submit it along with supporting documents to the NIS office nearest you. Avoid crowds and long lines. Get your money when you want it. The National Insurance Scheme, always working for you.
There is an easy way for insurance coverage today with no line in your way. All you have to say is
Genac.com. Everything you have is everything you have. So keep your assets covered and save 10% off your insurance when you renew by visiting Genac.com. You don't need to go into a branch. You can do just about everything online at genac.com. Remember, smart insurance saves. Who knows what tomorrow brings? So future-proof everything.
insurance on the go. Trust the brand that you know.
genac.com.
All you have to say is Genac.com.
General Accident Insurance Company. Future-proofing tomorrow.
Are you importing a used vehicle from the USA, UK, Japan, Singapore, or the UAE? Please be reminded that all used vehicles, including equipment such as backhoes, excavators, forklifts, riding lawnmowers, and trailers, must be sanitized before importation. Contact Auto Terminal Japan at www.inspections.jp for pre-shipment inspection details. A message from the Trade Board Limited.
The pandemic is unpredictable, but Real Money IQ is always ready for the next smart investment move. Once the economy begins to recover, investment opportunities in infrastructure sectors such as construction and mining will be on the rise. It's smart to invest in companies that produce or distribute building materials, or companies that finance infrastructure projects. Your wealth is waiting for your next money move.
Visit barita.com/opportunities for more growth coach insights.
Welcome back to the Morning Watch. Thanks for staying with us. I'm your host, Dylan Toussaint. Let's take a look at the newspapers to see what Jamaicans and others are saying. And in the Gleaner, Bellevue alarm as 35 are isolated with the virus. And then corner shops tough it out in lockdown misery. We see here also jab or jump. Government blame for vaccine mandate confusion in the workforce. In the Observer, on track but slow. JTA says problems remain despite improvements on first school day. And also healthcare providers suggest switch from oxygen-focused care. And we see also in the Observer, essential service workers pleased with fast food access. Those are some of the major headlines in our newspapers. Well, coming up next, we'll read back from our Facebook and WhatsApp question. What are your thoughts on pharmacists administering the COVID-19 vaccine? Please leave a comment on our Facebook page, Love 101 FM Jamaica, or WhatsApp 876-997-3125. We'll be right back.
that you wish could be attended to now? Want a platform to voice those concerns? This could be the place for you. Send your 30-second voice notes describing your issue to 876-997-3125. That's 876-997-3125. Be sure to type a voice for hope before sending the voice note. Then listen on Tuesday at 9:45 a.m. for a voice for hope. Share the concerns you have seen. You know, that street light that has not been working for a long time, or your community has not had water for 2 weeks now. Yes, here's somewhere you can share it. And maybe, just maybe, we can get some love on your situation. Remember now, send a 30-second voice note describing your issue and type a voice for hope before sending your voice note to 876-997-3125. A voice for hope. It's a problem, and we need a solution now. Love 101 FM, the family station, bringing a voice to your situation.
Welcome back to the Morning Watch. Thanks us. I'm your host, Dylan Toussaint. Let's join Siobhan for a look at how our Facebook and WhatsApp friends answered today's question. What are your thoughts on pharmacists administering the COVID-19 vaccine? Siobhan.
All right, so Stephanie here from Portmore says, I go to the Portmore Mall Pharmacy and I just love the way, they deal with people. I trust the pharmacist. I even call him friend.
Yeah.
So I think they should be concerned. A comment here on Facebook says pharmacists, they undergo so much extensive training in, dispensing medication, and nurses, they have undergone extensive training too, just to give us the vaccine. Legislation has been needed for 2 years to give, nurse practitioners extensive training. I'm sure I can make something out of this. It's quite a bit. Prescription writing, still no change. Why the rush now to cross over? There are enough nurses in Jamaica to do their job. Okay. And this one says, I think people should trust the pharmacists, even now, and lest they'll be hesitant. So they should rely and put their trust on the pharmacists. I think that's what you're trying to say, right? Very well. Keep the conversation going, folks.
Okay, thank you, Siobhan. And thanks to those who responded. We really appreciate your taking the time out to respond. Well, listeners, last week it was announced that incarcerated All-Star Vibes Cartel received the COVID-19 vaccine. However, the Jamaica Observer, in an August 31 article, reported that only a small minority of prison inmates have been vaccinated. What are the possible reasons for this? And what are the issues and implications arising from it? Well, to discuss these matters, we have joining us Senator Matthew Samuda, Minister without portfolio in the Ministry of National Security. Good morning, Senator Samuda.
Good morning to you and morning to your listeners. Thanks for having me again.
Great, good to have you with us once again. All right, let's hit the ground running, Senator. Presently, what are the stats in terms of the total prison population in Jamaica, and how has it been affected by the pandemic so far?
You have 3,700 inmates and wards in your custody. Approximately 3,400 are adult inmates and 300 juvenile wards. We've had relatively low COVID infection rates in our facilities since March last year. We have dealt with occasional outbreaks which we've been able to contain and safeguard spread from the rest of facilities by using proven methods. We've spoken to it over the period of time. We had built our own action plan off of the advice of the WHO, the CDC, even the EU CDC. We looked at what was working in North America, what wasn't working. We looked at what was working in our Central American counterparts, our Caribbean counterparts. And we built a strategy that we believe is fit for purpose for our realities. some of the things we've had to do, we've installed many more wash basins. We've had to distribute masks and sanitizer, as you'd imagine, through the facilities. We'd had to curtail visitation because the truth is the virus can't appear randomly. We'd had to implement a screening process for staff entering the facilities, everything from temperature checks to questionnaires, to strict monitoring of, inmates that they interact with. So when you do find positive cases, you're able to lock down potential spread before it goes too far. Yes. So we've had, tense moments and obviously nervous moments, as every once in a while when you hear of exposure, you do get nervous because it is a highly infectious viral disease, as we know. But generally, we've kept our infection rates low. We've had 2 deaths in the context of that. Was about 18 months, and both persons would have had significant comorbidities. But generally, I think we've performed well. Our infection rates are way below that of the region and way below that of our North American benchmarks.
How many deaths have we had in total due to COVID in the prisons?
2.
Pardon me?
2.
Okay. And how many have been positively infected, identified as being infected?
So the total number over the period would have been 196 which have recovered. We have currently 13 active. No. Where we've had challenges has actually been with our DCS staff, both uniformed correctional officers and indeed non-uniformed members of staff. So they interact in the public. Some take public transport. They face the same risks as the rest of the population. So we've had occasional issues with members of staff, which we try to contain. We do our best to provide them with what they need and to do the public education as best as possible. But we do, and we have implemented rigid screening for all persons entering the facilities.
Yeah, I wanted to ask you about that too. What are the stats in regards to the staff members?
Staff members,
the COVID infections and all that. Yeah.
We've had approximately 250 members of staff who have had infections at different points. 194 are recovered. We have 46 active cases. And we have lost 3 officers over the 80 days. There's no doubt that the team, they do traverse back and forth to work. They face the same risks as the rest of that.
Yes.
One of the things we've done, though, which I'm quite proud of, and if you'll allow me to tell you, one of the things that we did at Horizon is your remand center. So it tends to be the facility where prisoners tend to go back and forth to court more often. We have, over the last year, put in place a digital courtroom. We actually have 2 courtrooms there that allow prisoners who have mention dates, not full trials, but mention dates, to not have to leave the facility. Because what we've had to do is when prisoners leave the facility, or remandees rather, leave the facility to go and come, we have to then put them into quarantine so that they don't run the risk of infecting the rest of the inmate population. So these digital courtrooms, though there's obvious other benefits in terms of the digitization and the efficiencies and the cost saving, and we'll continue to do that throughout our facilities. From a health standpoint, it has helped significantly, especially in that facility.
Yeah, I'm sure. But you mentioned 250 cases among the staff members.
Over the 18-month period, with over 196 recovered.
Yeah. How many in all in terms of the DCS staff? How many people in all?
I just gave you.
No man, the total number of workers.
Oh, you have approximately 2,500 members of staff.
Okay, right. I just wanted to get
several of them, and your listeners should be aware also that DCS also covers the parole and probation departments. So you have civilian members of staff who interact in the public and actually do field work. So there is a different component to it. So the probation department and aftercare departments have had particular challenges as they go into community.
Yes. And among the juveniles, what are the stats there?
Well, of your 13 cases now, you do have an outbreak in your South Camp juvenile facility. So I believe 11 of the 13 cases are actually at the juvenile facility. We do have one case currently at the Hilltop facility in St. Anne. My information is, yes, there are individuals symptomatic. None are seriously ill at this stage, and we pray for their swift recovery.
Yeah. All right. We're going to take a break at this point, Senator, and we'll be right back.
Sure.
This is Love 101, the family station. It's now 7:45.
The first payment under the new social pension program will be paid on July 22. If you qualify for a benefit and submitted a completed application before June 30, your payment can be collected beginning July 22. Check your text messages to confirm your payment arrangements. For further information, call 876-922-8007 or check the ministry's website, mlss.gov.jm. The social pension program, caring for our elderly. A message from the Ministry of Labor and Social Security.
Making money work for you is the ultimate money IQ move. Simply earning and saving cannot keep up with inflation. Instead, consider investing in the stock market. A stock makes you a shareholder and could entitle you to dividends. Buy enough stocks in the right companies and those dividends can really pay. It's a long-term move, but a good pick can build not just wealth, but a whole legacy.
Visit barita.com/opportunities for more growth coach insights.
From generation to generation, Jamaicans have depended on J&B Bank to make the pride and joy of providing a safe place for their families possible. Now, with no processing fees and no down payment mortgage options, you can open the door to your own sweet home, a legacy to hand to your next generation. Visit jnbank.com to get pre-approved today. J&B Bank will help you find a way.
There is an easy way for insurance coverage today with no line in your way. All you have to say is
Genac.com. Everything you have is everything you have. So keep your assets covered and save 10% off your insurance when you renew by visiting Genac.com. You don't need to go into a branch. You can do just about everything online at genac.com. Remember, smart insurance saves. Who knows what tomorrow brings? So future-proof everything.
insurance on the go. Trust the brand that you know.
genac.com.
All you have to say is Genac.com.
General Accident Insurance Company. Future-proofing tomorrow.
Welcome back to the Morning Watch. Thanks for staying with us. I'm your host, Dylan Toussaint. And in this, the second watch, we're discussing the prisons, COVID-19, and vaccine hesitancy. And we have online Senator Matthew Samuda without portfolio in the Ministry of National Security. Senator Samuda, in the Observer report that was mentioned in the preamble, it states that 70% of the inmates have refused to take the vaccine. Now, what were their main reasons for such a refusal, as far as you know? And I'm just wondering, were there any religious reasons given?
Admittedly, none that have been brought to my attention. I think our current vaccination rate before last week's exercises would have been at approximately 10%, and we do have some who go in and out, right? So it's a bit of a moving target. But there are other institutions that though had been offered previously, persons, I guess, with the rise in cases externally, and I think with people generally getting a better understanding of the severity of the disease, more persons indicating willingness. So I know, I haven't gotten final numbers yet, but I know we would have done approximately 200 persons on Friday, both which would have been split between the Tower Street Adult Correctional and indeed Horizon. So the numbers will go up. We continue to do the public education and encouragement. The facts remain that when we consider one of the measures we've had to take, which has been particularly tough on the inmates as well as tough even on the administration, as we've had to allocate greater resources to manage the situation. We've had to curtail visits. This has a huge impact on the psychosocial support system for those who are in our facilities. But this is one of the ways that we've kept COVID numbers low. We can't look to changing this policy structure in our adult institutions if...
Well, before you go there, though...
if they're not vaccinated.
Yeah, before you go there, though, Senator, why the refusal, though? Why 70% is a large number? What have you been gathering? What have you been hearing? What have they been saying for refusing to take it?
So I can't tell you what they've been saying because I don't really interact in that sort of way, and I haven't been given any wholesale reasons. The truth is, now that we have significantly more vaccine availability, we'll be doing significantly more engagement. So I suppose after that engagement process, we'd have a better feel of the hesitancy. But what's important to note now is that after last week's exercises, and certainly within this week, I'd imagine that the prison population vaccination rates would come in line with the national population vaccination rates. So I'd imagine that the same reasons that prevail nationally would have triggered some hesitancy would be the reasons there. But we'll watch and see, and I guess when we have that definitively, we'd be happy to share that with the public.
I think you mentioned earlier that 10% of the inmates have been vaccinated so far.
Approximately 10% would have been vaccinated before last week.
Yeah.
Before last week's exercise.
Yeah. What?
Over 200.
Yeah. What portion of that are fully vaccinated?
I don't think the first set that would have done it would be due for their second dose yet. I believe they're due in the next 2 weeks. So I think that particular vaccination, in terms of fully vaccinated, would be very high. What we're doing now is that we've switched gear and we're offering the Johnson & Johnson because it is a logistical challenge with how we mobilize public health workers and other support staff into correctional facilities to the mass vaccination exercises. So it is easier significantly for the one dose rather, to get that vaccination rate much higher. So the percentage that we have now is really, I think, largely referring to single doses, but in the next 2 weeks to 3 weeks, I'd imagine that percentage would be fully vaccinated persons. And with the increases in interest now, I think that number will move closer to 30% within the next 4 to 6 weeks.
Yes. And of course, as was mentioned in the preamble, infamous individual was vaccinated recently. I gather that the AstraZeneca brand was given to him. I'm just wondering, do the inmates have a choice in the brand of vaccine they'll receive?
A choice hasn't been typically offered to the inmates. I think it's based on availability and based on the public health team that is in the space. I can tell you it would be very difficult to offer Pfizer in the space because of the logistical challenges around deployment. It is our intention to significantly focus on Johnson & Johnson going forward. Once we've completed the second doses for all of who would have received their AstraZeneca, the focus will be on Johnson & Johnson as opposed to AstraZeneca. But there was some amount of second doses being done, and I don't think there would be significant opposition if someone says, since it is available, can I take this one? I don't see any reason that we would object to it. At the end of the day, we're just trying to get as much of the population vaccinated as possible.
Yeah. So if there are persons who expressed a preference or one over the other, how would that be dealt with?
Well, it is a prison, right? So I can't tell you that people have freedom of movement or freedom of choice in that sort of space. If there is availability based on what we're doing at a particular time, I wouldn't object to them being able to say, well, since there are two, here's one. If there's one available at the time or one that has been deployed, then that is the option. We won't be deploying an individual based on, individual inmates' feedback. That's not how it works in a correctional facility. So no, they don't have open choice. But if there is availability in the space, then nobody will oppose them taking it. It is the intention to offer significantly the Johnson & Johnson to majority of the population. We would have offered the AstraZeneca based on its availability in its early days.
There are those who are believing that because that individual received his vaccine or willingly took it last week, that it would influence in a positive way other inmates to take it. What do you think? What's your take on that?
So as a general rule of thumb, I don't comment on the health or healthcare decisions of any individual inmate, and I wouldn't generally make an exception in this case. What I want to make abundantly clear to all those who are in the correctional system, all of the staff, all of the team, anyone who may have family or friends who are indeed incarcerated, that the government has made it available in all of our adult institutions at this stage. Every single adult institution has had a vaccine exercise, and it has been made available to inmates. We will continue to do so that they're able to protect themselves adequately. I can't get into the individual choices or individual wants and whims of any individual inmate. That wouldn't be appropriate.
Let me ask you, in light of the infections, the infectious nature of the Delta variant and the recent surge in the cases, what adjustments have been made in regards to cell placements? Because I'm picturing that situation. Persons are confined in cells, and of course, when you talk about physical distancing, that is a no-no in that regard. How is that being dealt with, Senator?
So whenever you have cases or suspected cases in the facilities, you move to lock those down very quickly, and you ensure that all of your population has adequate access to masks and to sanitizer. The nature of our correctional services is that we've not invested what is required over the last 58, 59 years of our independence. Now, because there's a virus illness, now I can't suddenly create new square footage that doesn't exist. Right? That takes a practice, it takes budgeting, it takes years of planning. Some of which is underway now, but will likely not benefit the impact of the COVID epidemic. So the truth is, there is very little adjustment that can be made in that space. All it does when you have something like that is forces us to tighten up on the enforcement of our entry protocols. Because that is that is by far the greatest risk to your population. Because if the virus doesn't magically appear inside, right? So if you manage your entry protocols well, you're likely to keep your infection rates low. And all it takes is one slip up, which is why we have to be very strict. And we continue to monitor it. And we actually use the inspector at the Ministry of National Security to do reviews from time to time to ensure that the team is indeed sticking to the protocols that are in place.
So are they wearing masks throughout the days? How is that
masks
done? What do you mean? Are they required to wear masks throughout the days?
All staff is required to wear masks all throughout the course of the day. The nature of the correctional facilities is that it is very difficult to force masks. There are sections of the properties that they can't access without putting on their masks, obviously. But certainly when they're in a cell with persons that they tend to be grouped up together and clustered together, I'm sure they're not necessarily wearing the masks as they're supposed to. What's important for the public to know is that we continue to do the public education and continue to provide. What you find is that whenever there's a case, all of a sudden everybody gets nervous and mask wearing goes up significantly. Once you reach to a stage where there's no active cases in a facility, people tend to get lax and you have to be forcing them and going back behind everyone. I think that's typical of the rest of society. So we do enforce and we do encourage. I can't tell you there's 100% mask wearing, but I can tell you there's 100% mask provision.
Oh, they have been given. That's what you're saying, Senator? All inmates have been given masks?
On multiple occasions, both reusable and surgical masks when necessary.
Yeah. All right.
Most of our adult correctional facilities have tailor shops and dressmaking courses, etc. So very early in the day, we had actually purchased what was necessary to make more than enough masks for every inmate to have more than 2 reusable masks that were provided to them during that period. We've also provided, every time there's an outbreak, you ensure that you have additional single-use masks to increase the compliance and to increase the protection of inmates in the space. We've increased the cleaning of surfaces. We've had to spend more money on things like bleach and alcohol, as you can imagine, as we do our best to maintain the surfaces that you touch to ensure that spread is lower.
Thank you. Thank you, Senator. We have to leave it there. Thank you so much for joining us.
Sure.
Have a productive day.
You too.
Thank you, listeners, for being with us. Thank you. For information how to get copies of this program, call our production department at 876-968-95967. You can now listen to the Morning Watch on Love 101 app. Download it today. This has been the Morning Watch. Thanks to our producer, Miss Kathy Gale, and our guests. I'm Dylan Toussaint, and you're back to Love in the Morning with Siobhan Blair.
And the Morning Watch is brought to you by Smart Insurance, General Accident, and Home and Things. Big thanks to our sponsors.
There is an easy way for insurance coverage today with no line in your way. All you have to say is
Genac.com. Everything you have is everything you have. So keep your assets covered and save 10% off your insurance when you renew by visiting Genac.com. You don't need to go into a branch. You can do just about everything online at genac.com. Remember, smart insurance saves. Who knows what tomorrow brings? So future-proof everything.
insurance on the go. Trust the brand that you know.
GENAC.com.
All you have to say is Genac.com.
General Accident Insurance Company. Future-proofing tomorrow.
Imagine styles of tiles for every room. So trendy, sophisticated, stunning, yet cool. Simply unique. Tiles for floors to walls and everything in between. Make your best home anything but ordinary. At Home and Things.